My name is Bronwen White. I am with the Boston Public Health Commission in Boston, Massachusetts, and I work with the Division of Violence Prevention.
Heavenly Mitchell, Boston Public Health Commission, the public health agent for the city of Boston. We serve a population of the most vulnerable individuals in the city of Boston. So our mission is to protect, preserve, and to assist those individuals. So some of the pressing issues that we're faced with is housing. A lot of our families are homeless. So we're working with the families around securing housing for the children, which we know has an impact on their child development.
So the City of Boston conducted a survey to assess for adverse childhood experiences in the city and found that 1 in 6 children have been exposed to one or multiple forms of trauma or violence. So often there's overlap between domestic violence, violence in the community, financial strife, and other hardships. And so the Division of Violence Prevention partnered with Healthy Start Systems to develop a training initiative around training and education for home visitors to support them in supporting resilience in children and families exposed around intimate partner violence as well as community violence using a trauma-informed approach. And that survey found that post-training that home visitors had increased their knowledge and skills as it relates to trauma, intimate partner violence, and also resilience as well. And I think that that survey also found that home visitors were coming with a lot of strengths and coming with a lot of strategies already to support resilience, and that then there were things that were built off of as a result of the training. And we conducted a post-post survey as well, and a lot of those effects sustained.
Cradle to community for me really means from womb to community. I take that phrase from a maternal and child health perspective. And that's inclusive of the partners, that's inclusive of everyone. When making sure that the wound is healthy, that a healthy vessel for that child to go into this cradle. What it also means to me is it will have an impact on other systems. Systems being the pipeline to prison, systems being institutional racism. Making sure we're building a collective impact forum which is inclusive of the families we serve. So as we talk about a cradle to community paradigm shift, we're changing our narrative to include the voices and the dialogue of everyone. It's an inclusive process.